Welcome to the Rizzilient Health and Wellness Report, and today we're going to talk to you about walking. Research shows that moderate intensity exercise at least 3 times a week can increase your lifespan by at least 2.5 years. One of the most underrated exercises that you can perform anywhere and don't have to go to a gym to do is walking. Here's a sample program for you. On Monday, Wednesday, and Friday, walk 2 miles in less than 30 minutes. That's 15 minutes per mile. You may have to work up to this quick pace. Begin with a 20-minute mile and progress as you feel comfortable. Be sure to get your doctor's approval before you start this program or any other workout program. Warm up by walking at a slow pace for 1/4 mile. Then spend 5 minutes stretching your hamstrings, quadriceps, and back and arm muscles. This will help to prevent musculoskeletal problems that can occur with any exercise. Walk at your designated brisk rate for 30 minutes. Don't worry about checking your heart rate. Instead, keep count of your steps per minute. To walk 2 miles in 30 minutes, shoot for a pace of at least 120 steps per minute. That's 60 steps in 30 seconds. To start with a 20-minute mile, walk 90 steps per minute. Keep your arms next to your body, bend your elbows, and pump your arms at the same pace you move your legs. The faster you walk and the more you pump your arms, the greater the aerobic benefit. Cool down for 5 minutes to prevent lightheadedness or an irregular heartbeat. 65% of severe cardiac events occur after a workout because blood has been diverted from the heart and pumped to the exercising muscles. Walk slowly. After 5 minutes, take your pulse. If it is still over 120 and you are under 40 years of age, or over 100 and you are over 40 years of age, you may be exercising beyond your capacity. The next time you exercise, don't walk as fast or as far. Walking mistakes. Although most of us have been walking since we were toddlers, at least 30% of all people still haven't learned how to walk correctly. Whether you're walking for pleasure, walking for exercise, or just walking to get from one place to another, it's important to walk properly. Here's a few examples. Not maintaining proper posture. Poor posture puts extra stress on joints, vertebrae, and muscles causing pain. The correct way would be to tuck your chin into your neck so your ear, shoulder, hip, and ankle form a straight line perpendicular to the ground when you're standing still. Then hold this position as closely as possible when you walk. This avoids undue stress on any one joint or part of your body. Another mistake is arching your back. This causes lower back pain and shortens the length of your steps. The correction would be to do a pelvic tilt. Tuck your buttocks under your body and hold in your stomach while you walk. This will take conscious effort at first, but after a while, your stomach and buttocks will stay in automatically. Walking this way strengthens your back and the stomach muscles, which distributes weight away from the lower vertebrae, eliminating back pain. Another mistake is keeping your arms still. You lose almost half the exercise value of walking. Increasing your heart rate and working your shoulder, back, and arm muscles by not moving your arms. The correct way to do this would be to pump your arms, bend your elbows slightly for regular walking and 90 degrees for aerobic walking. Guide the arms straight forward and back, hands raising as far as the chest, at least to the waist. Let the inside of your arms rub the sides of your body. You should never hear your clothing rubbing. Another mistake is walking duck-footed, with the knees pointed out, or pigeon-toed with the knees pointed in. This puts stress on the knees and ankles. They are hinge joints, made for forward, not side-to-side motion. Stress causes knee and ankle pain. The correct way to do this is walk with your feet parallel and use the heel-toe roll. Land the heel first and turn the ankle out slightly. about the width of a finger. Then roll on the outer edge of the foot until you reach the toe. This aligns the lower and upper leg. Another mistake is walking with your feet too close. This makes it easy for you to trip and fall. The correct way would be keep your feet hip width to shoulder width apart. And lastly, taking short steps. This also reduces the exercise value of walking, and it causes the leg and hip muscles to tighten. The correct way to do this would be by reaching further with each step and using arm pumping and the heel toe roll. Most people can lengthen their average step 3 to 8 inches. Longer steps burn more calories, work leg muscles, raise heart rate, increase circulation, which will make you feel more energetic and increase walking speed. Walk for your heart. Brisk walking keeps your mind sharp, but it also does more. Recently compiled results of a study involving 72,000 women aged 40 to 65 showed that as little as 3 hours of brisk walking a week reduced the risk of heart disease by as much as 40%, and 5 hours of brisk walking cut the risk by 50%. It is important to obtain this benefit. You must walk at a rate of at least 3 miles per hour. Casual strolling will not produce the same results. Walk for good health. Exercise doesn't have to be strenuous or punishing to be effective. Despite its economy of muscle use, walking is considered by most experts to be one of the best exercises. Some of the benefits are a preventative and a remedy for respiratory, heart, and circulation disorders, weight control, like walking may take off pounds or keep weight at a desirable level. It aids in digestion. It's an antidote to physical and psychological tensions. Walking works as a second heart, expanding and contracting foot muscles, calves, thighs, and buttocks, help pump blood back to the heart. Some other benefits are time and place. Whenever it can be fitted into a daily routine, a mile takes only 15 to 20 minutes. Make a plan for wellness. Passing an annual physical exam was once enough to satisfy most people about their health, but today an increasing number strive beyond that for optimal health, or the condition of wellness, as it is known. Essential to achieving wellness is a plan that is both personal and practical. Ask yourself, why are you doing this? Thank you for listening. Please like and subscribe so you can receive essential wellness information to help you on your journey for optimal wellness.